And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And incontinence, not something that a whole lot of people, men or women, like to talk about, but women in general, this happens typically after childbirth, as they were talking about. But what else can women do? They mentioned exercise.
Well, I think all the things that they mentioned on the segment, it sometimes can be a part of aging, and I think the main thing, like the segment indicated, is talk with your physician about it to see what your options are. I think most people, if it is mild, it's not that frequent. They just kind of deal with it. Certainly, as you get older, the more medical problems you have, and yes, the more kids that you have, it tends to disturb the musculature and just the orientation of the bladder and where it sits, and it tends to weaken what we call the pelvic floor, which is a collection of muscles that holds everything in place. And so when you have menopause and children and diabetes and gain weight and heart failure, all of that weakens it, and so it changes the position of the bladder, and so it tends to hold on to urine. It tends to cause leakage of urine because sometimes the bladder will get so full it just spills over. So a lot of times, despite the things that they mentioned, people just don't have the time or the desire to really do any type of training exercise. They want something quick and easy, and we have a slew of medications on the market that are very effective, minimal side effect profile that work very well, and that's normally what patients end up doing. Now, if those medicines don't work and they continue, that's normally when we send them to the urologist. They can do what we call urodynamic testing in their office to get a more clear picture of what actually is going on. A lot of times this is based purely on history alone, but sometimes if it doesn't work, they can do urodynamics in the office and really get a clear picture of how the bladder is functioning or not. Sometimes they do need surgery, but this is typically a non-surgical issue because the medicines are very effective and we can get it slowed down for the most part.
It's not something to be embarrassed about. Just talk to your physician.
I can understand, obviously, how it can be embarrassing. Yeah, absolutely, but the medicines are effective and they normally have a low side effect profile. And so, yes, talk to them because you can improve your situation and go out. Because a lot of times people will avoid going out in public. They can't wear certain clothing. So, yes, it can improve your lifestyle, and talk with your physician. You may not be a candidate. You might be a candidate. So that's why we ask people to come to the office so we can talk about all those issues. Things change all the time.
Now, we talk about women and menopause. What about men going through not necessarily menopause, but maybe a menopause, if you will, and changes that they go through in possibly hormones? Would they notice like a decrease in their testosterone level, and what would that be?
I mean, not necessarily. That's been a huge issue maybe the past 3 or 4 years. Low T, it's been heavily publicized recently. Now we're seeing a backlash with the aggressiveness of the advertising. Now we're seeing the lawyers come on air and talk about all the side effects of testosterone. For the most part, typically, classically, men come in and say, I just don't feel well, my sexual desire is low, I just don't have the energy, the strength that I used to have when I was young. And a lot of times we will check the testosterone, and if it is low and the symptoms fit, we will try a trial of the medication for an individual, bearing in mind that there is always potential for side effects. Even with the bladder medicine I mentioned for the ladies, there's always potential for side effect. And so this medicine has helped a lot of men, and we do prescribe it, but you just have to be aware of the side effects. So most men are just fatigued and just don't have that energy and that vigor that they want to have, that they used to have.
Something you could talk to your physician about.
Go see your doctor.
All right, we've got lots of questions, so we'll get to those in just a minute. So we'll answer your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer your medical questions. This person wants to know, is there any truth that kids taking Adderall can cause them to have suicidal thoughts?
I mean, I think anything is possible. We talked a little bit about adverse reaction. I think there's been a concern in the past year or so that we've overprescribed these medications, just been way too aggressive with the young kids, with getting them on this medication. It's kind of everybody's fault. It's not just one person's fault, it's everybody's fault. And so these are some of the side effects and adverse events that potentially can happen. These are very strong medicines, powerful medicines. We're using them in children who are developing, their neurological systems are developing, very sensitive. And so I think anything is possible, and certainly if this is happening to your child, get him off that medication, get to the healthcare professional who prescribed it, let them know, because this is pretty dangerous stuff and someone needs to know.
Okay, another question. Can a person really be allergic to mosquitoes?
Yeah, I mean, I think anything that your skin comes in contact with, dust, if you will. I don't know about dust, but a mosquito certainly.
If you are, I'm sorry.
Yeah, but you know, a mosquito certainly can inject certain things and bite your skin, and you can be irritated with the things that are in the mosquito touches. So absolutely, Benadryl, antihistamine, steroids is normally what we use to treat any type of allergic reaction.
Okay, a 59-year-old female. What is bipolar and what can cause it?
It's a psychological disorder where people have highs and lows. They can be depressed and what we call manic. They kind of oscillate between the two. Some people
It's really high highs and
really high,
low
really
lows.
low, and they oscillate. And a lot of people are actually diagnosed with depression, initially placed on antidepressants, and then it causes them to be really high in a manic state. It may take some time for a person to be diagnosed with bipolar disorder. We don't actually know the root cause of what causes bipolar disorder. It is very common. A lot of people don't like that diagnosis because there's some stigma associated with that diagnosis. And unfortunately, part of the disease process, patients are very non-compliant and they tend not to take the medicine and continues those highs and lows all the time. So it is a very serious disease. It's very prevalent. But the medicines are effective, and the kids and the patients need a lot of support, certainly from their family and this community.
Okay, a 66-year-old female with arthritis in both knees, but worse in the right knee than left. Is walking good for it?
I think walking is always good because it keeps you in overall general health. A lot of times because of the pain, patients become more sedentary, they gain weight, and it's going to cause more pain in the knee.
It's a vicious cycle.
It's a vicious cycle, and we see that a lot of times patients need to exercise, lose weight to help with the joint pain, but they're stuck. So certainly exercising is good for the knee. Certainly work with your orthopedist or primary care physician to gear the workout for you. Certainly using anti-inflammatories, injections, and sometimes surgery at the end of the road.
Should you elevate it at night and ice it?
I don't think that really matters.
Okay.
I mean, lifestyle is big. We talk about it all the time. Make sure you don't have gout, lupus, these other illnesses that can affect the knee.
All right, Dr. Levine, as always, we appreciate
Yes,
you
ma'am.
stopping by and answering our questions. And of course, you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.